Hi guys, we're going to pick up today on ability to move when we're continuing on with our discussion about secondary assessment. So going to our slides, we're starting right here, okay? A couple terms that you need to have added to your note cards, okay? The first one is paralysis, okay? I'm sure most of you have heard about paralysis, all right? And a paralysis is the inability of your body to move. And that can be something as simple as you were laying on your foot and you get up and it's numb and you can't move it. Okay, that is temporary paralysis. Okay, it could be something more significant where you've had an injury that paralysis can last for days, weeks, or it could be permanent. Okay, there are three different types of paralysis that we're going to talk about. All right, these are conditions that relate to our spinal cord. Okay, the first one that we have is called hemiplegia. All right, and it's the inability of you to move one side of your body, like the left side, or you're unable to move the right side. Okay, and what this tells examiners and what it tells doctors is where the injury is. Okay, all right, the higher that the injury occurs on the spinal cord, the more it affects. So if my injury is up closer to my neck, anything below that is going to be affected. If it's down further to my hips, then my upper part of my body is not going to be as affected. Okay. The next one that we're going to talk about is paraplegia. Okay. Notice the same ending, P-L-E-G-I-A. Okay. Paraplegia is the inability to move your legs. Okay. You'll see these people in wheelchairs. Okay, they're unable to move their lower body, but they still have full functioning upper body. All right. The last one that we have is quadriplegia, and that is when you are unable to move both your arms and your legs. Okay, remember quad means four, and your four limbs. Okay, can't move either arm, can't move either leg. Okay. Moving on with some ability to move, there are three body positions that your body naturally goes into when there's a spinal cord injury. Okay, it's just kind of one of those like defense mechanisms. Okay, the first one that we see is decerebrate, then we have decorticate, and then we have placid. Okay, and we're going to learn the difference between those. Decerebrate is a body position that looks like this image right here, with everything in hyperextension or extension. Okay, you can notice that his arms are fully extended, all right, as well as his legs all the way down to his toes. Okay, and it's kind of like a forced hyperextension. Okay, it's not slack, it's not relaxed, it is stiff and fully extended. Okay, this is the position for decerebrate. The next one, decorticate, okay, is similar in the fact that we still have extension in our lower body, okay, but the arms the arms actually come up into flexion. Okay, they come up into flexion, and this is just depending on what part of the body is injured. All right, what part of that brainstem, spinal cord is injured. The very last one that we have is placid. Okay, that's lifeless, motionless, limp. Okay, and this is going to be an indication that the person has already passed. Okay. On a much lighter note, let's talk about pain. Okay. Two very important concepts to understand is the difference between pain threshold and pain tolerance. Okay, everybody has a different ability to tolerate different things. Okay, whether that's pain, whether that's your patience. Okay, every person is built a little bit differently. Where we see pain threshold, okay, that is the point where you first start to feel pain. Okay, remember of threshold, like you walk through a door threshold, the very opening of the door. All right, you went from not being in pain to all of a sudden being in pain. Okay, that's pain threshold. It might take no time whatsoever for me to reach that threshold. All right, but you might have a higher pain threshold, and so you can take more. It takes longer for you to feel that pain. The second term is pain tolerance, okay? And that's how much you can take, okay? If I had a 5 pound weight and I was to put it on my hand, that might be enough for me. That's too much pain. But you might come along and put that 5 pound weight on your hand and you're perfectly fine. All right. You might be able to take a 10 pound weight or a 15 pound weight. All right. That's your tolerance. Okay. There's differences in males versus females, okay, when it comes to pain threshold and pain tolerance. But there's some other things that can affect that, like paralysis, okay? If you can't feel it, then you have an altered concept basically of pain threshold and pain tolerance, okay? Because your nerves aren't firing. Any medication that you're on can alter the way you feel, the way things feel on you. Same thing with shock. When you're going into shock, your body is starting to shut down, and so that is going to play a role in how your body responds to pain. So just keep in mind, guys, that in the inspection section or the observation section, it is information that you can gather by looking at your patient, okay? Things that you can figure out, trying to lead into what is wrong with your victim. Our next section is called testing or special testing, okay? This is when we're going to do a little bit more specific tests, okay, which will help us narrow down what specifically is going wrong with your patient. So you guys will see this word a lot, palpation. Palpation is just referring to examination by touch, okay? Feeling around. If my shoulder hurts, the examiner is going to locate different bones and muscles and touch and see what they feel, okay? A big thing to remember is you are going to stop your palpations if you feel crunching, okay? Crunching's never good, okay? We see that the word crepitus, okay? Crepitus is going to be referring to that crunching sound, and it's usually an indication that there's a fracture, okay? So there is a general order to palpations, especially if your victim is not able to respond to you very well. In athletic training, most of the time we have kids come in and they can say, hey, Coach Tice, my ankle hurts. Well, I'm not going to start touching his elbow if his ankle hurts, okay? However, there are going to be some times in first aid when you approach a victim and they cannot let you know what is wrong. And when that happens, there's this general order right here that we're going to follow to examine and figure out what is going on with our victims. The first area that we're going to pay the most attention to is that head, all right? Whether that's anything from looking for any bruising, any obvious bleeding, checking those ABCs, all right? Clearly in our head, there's our brain, okay? And we're trying to make sure, see if we can see any signs that there's trauma to the brain, okay? The next is going to be your chest or your thorax, okay? That's where our heart lives. So we're trying to see if is there any trauma that we can see that's noted in that area, like bruising, okay? Do they have some type of hemorrhage, internal bleeding? Okay, going down to the abdomen where our stomach is, we have a lot of important internal organs, a little bit less important than our brain and our heart, okay, but still vital. And then we go to our upper and lower extremities, okay, your arms, your legs, no internal organs in there, okay. So we've already kind of ruled out anything more important. And then the last section is going into these special tests that we're going to talk about now. We talked a little bit about listening to the heart with the stethoscope during blood pressure. Okay, kind of keep in mind that it is whether you're listening to breathing or you're listening for the heartbeat. And that stethoscope is used to help determine is there proper blood flow going to the heart. Your heart has 4 chambers, with that stethoscope you can hear blood going in and out and in and out, and that's vital for your survival. Our next section is range of motion, and in sports medicine we use this a lot. Okay, it tells us a lot about our bodies, and it tells us a lot about our patients. So you guys will see me abbreviate range of motion, ROM, a lot. Okay, it's just for ease. Okay, with an injury, we have 3 types of range of motions that we deal with. All right, the first one is active. Okay, active range of motion is what the patient can do on their own. Okay, so me by myself, I am flexing my elbow. You did not help me. There is nobody else applying any pressure. That's me on my own. That is active range of motion. The second is passive range of motion. That is where the examiner is going to move the victim. So if my arm is like this, the examiner is going to take my elbow and move it. My injured body part is not resisting. My muscles are not clenched. It is just nice, easy movement from the examiner. The last one is resistive range of motion, and that's where the patient has to overcome a force. So if I am pushing against my arm and I still have to curl against my pressure, okay, or somebody else is pressing on my arm, that is resistive range of motion, because they have to have some strength to overcome that. Okay, range of motion is very important. Okay, something to keep in mind though is you do not want to perform any type of range of motion testing if you think that there's a fracture. Okay, we've already talked about this before. If you have a broken bone, you don't want to move it and create a bigger broken bone. And you also don't want to do this if you suspect any type of spinal cord injury, because any extra movement with a spinal cord injury could be life-altering. Okay? Another big thing to keep in mind is that we are going to always want to compare bilaterally. And what that means is both sides. So if I'm going to test my left arm, then I'm going to test my right one as well, okay? It's really important because you can tell the difference between one side or the other, okay? What's normal for me might not be normal for you. But if I can do it on one arm, I should be able to do it on the other arm. In order to test range of motion, okay, we use what we call a goniometer. Okay, and that's what this is right here. Okay, a goniometer has all these different numbers and degrees on it, and using these 2 arms, a stationary arm and a movement arm, we can figure out how much range of motion does somebody have. Okay, we're going to talk a little bit more about this in class. I'm going to show you some of the goniometers and how we use them. Okay. We will pick up next time on our manual muscle testing chart. All right.